The rising cases of coronavirus disease globally, with Nigeria recording over 32,000 confirmed cases, more than 700 deaths, and the need for farmers and processors to actively carry out their farming activities for food sufficiency, prompted the federal government and the International Fund for Agricultural Development sponsored Value Chain Development Program, Niger State Office, to further sensitize its value chain key actors to the need to follow all the precautionary measures laid down to protect themselves while they ensure food for the populace. 240 producers, processors and marketers across the 8 participating local government areas of Ifad Vcdp, with 30 participants per local government area, were enlightened on all they need to know about COVID-19 and perfect ways to guard against contracting the virus so as not to affect their agricultural activities. While in Bida, State Program Coordinator, Ifad Vcdp, Dr. Matthew Ahmed emphasized that the health of the program's beneficiaries is paramount if their intervention must further succeed, hence the need to create the necessary awareness on the virus ravaging the world. He said the leadership of the program thought it wise to allay the fears of the value chain key actors, explaining that even if the country is at community transmission stage, it should not stop farmers, processors and marketers from carrying out their activities, as all they need to do is to follow guidelines.
They need to take only precaution measures to ensure that they don't contact this disease, as long as they use their masks, they maintain social distance, regular washing of hands and other precaution measures. We know that if we didn't address this issue, it will affect food security, and therefore we also need to do this sensitization so that they know that they will have access to their input, and at the same time that does not prevent them to go out to get this input at the redemption centers, and then that also will enable them to go to their farms to apply these inputs.
A public health physician at the Community Medicine Department of the Federal Medical Center, Bida, Dr. Eunice Modu, who took the participants through what the disease is all about, its symptoms and preventive measures, said 80% of people that contract COVID-19 can recover, while 20% may retrogress. Hence, the instruction to wear face masks is a mandatory responsibility. She urged them to always observe standard hygiene, use alcohol-based sanitizer, and strictly observe social distancing.
COVID-19 is real, and we've not been able to get the curve of the rise in transmission up till now. So if we are not careful, it can become worse than it was at China. Risk communication cannot stop. We will continue to educate the people. We will live and practice by experience. So we are doing what is right in the hospital and teaching people to comply. But the attitude of the person is the one that will help the person comply.
This awareness has made us to believe more, apart from what we've been hearing from the press, the government. But this awareness that came to our doormouth sensitizes us more. And so the best thing for you is to keep distance keeping, wearing your mask, hand washing, all those bits they ask us to keep, so they are able to tell us. And I believe all of us here now will be agent of information dissemination to the other people around, so that they will not be attacked.
I have been hearing about the COVID-19 issue, but the one that I learned more today, I have not even heard about it before, how to prevent the symptom that you will see from somebody and you do away from that person. I learned a lot about it.
Participants, who are representatives of the value chain key actors, are expected to step down their awareness to their various groups. Mercy Fabi, NTA News.